Good afternoon. Welcome to the webinar 2 of the 4-part career series organized by the CWEEL organization. I am so happy that many of you are tuning in to this program today as audience, as also the AWE and CWEEL members. I recognize many of you. I'm particularly grateful to have two incredible women, Devra Thatcher from NYSERDA and Alison Shea from Siemens Industry join us as speakers for today. You know, when I think about the pandemic and its impact, my mind goes immediately to Greta Thunberg and her plea for the global warming. She has been begging us for the past couple of years to do something about greenhouse gas emission and pollution. And then all in a sudden, the pandemic comes and it seems to have done the trick. It surely has cleared up the pollution from the roads, from the buildings, from the factories and so on, and has made a huge dent for global warming. This is the only positive impact I could see coming to our industry from COVID. However, our speakers are going to be talking about some more impacts, say operational impact or even to personal life, and how to cope up with them also. By the way, my name is Nandini Mooli, and I am going to be your moderator for this session. I'm a board member in CWEEL, responsible for the scholarship and awards committee affairs. I also own and manage a small business, eSide Consulting, where we do a lot of consulting work, engineering work for energy efficiency and distributed energy resources. I know some of you may be wondering, what is CWEEL? CWEEL stands for the Council on Women in Energy and Environmental Leadership. It's an international organization, part of Association of Energy Engineering, AWE. It provides networking and support for women globally in the energy field through mentoring, providing scholarships. We also have training, such as what we have today, certification programs, and quite a lot of networking. So you can go into the www.cweel.org and check us out. We have close to 10 women in different committees taking care of these support network activities for you all. So please do go to the site and become a member. While you are there, you can also see what kind of webinars are in the plans in this current series. Third one is going to be happening on June 23rd, Tuesday. The title is Furloughed, Graduating or Let Go, What's Next? And then the fourth one would be Working in a COVID-19 World on June 30th. Coming to today's session, the format is going to be very simple. We'll have the two speakers speak about 10 to 12 minutes or so, and then we'll open the floor to you all for Q&A. And you can come in through the chat box. You also could ask us any type of questions related to the audio, video, and so on. I have Michelle Whitlock from the AWE headquarters, who is providing the technical support. She's the guru for us from the AWE headquarters. So she will be queuing in the questions from you, and that would be the format for today. Now, main program. I cannot wait to introduce two women who are going to be giving us quite a lot of insightful information today. First is Alison Shea. She is the Regional Business and Sales Manager from Siemens Industry. She's managing individuals, developing multidisciplinary energy and environmental solutions for public and private sectors. She has people working for her in 9 states, Maryland, Virginia, DC, Ohio, Kentucky, Tennessee, and parts of Delaware, and so on. And Alison has over 30 years of experience in the energy field and holds a BS in mechanical engineering from Virginia Polytechnic Institute and State University. But above all, I enjoy the friendship with Alison as a colleague in the Maryland Clean Energy Center, MCEC we call it, and we both are council members there. So Alison, please take over.
Great. Well, thank you so much, Nandini. Can you hear me okay?
Yes. Yes.
Great. So I'm really excited to be a part of the discussion today. And I really think over the next 30 minutes, I truly believe that the information that's going to be provided by myself and Devetta will really convey very direct experiences on how coronavirus has impacted us in both our places of business, but also very, very much on the personal level. I really think it goes without saying that businesses are really feeling a direct blow from coronavirus. And I hope to share a bit of insight relative to how businesses and those of us who are employees of businesses are starting to react and respond to what has taken place over the last couple months. And I really hope by doing so that it might influence our own personal attitudes towards the businesses that we're relying on. And for those who are directly involved in business-to-business activities, it might provide you know, a little different perspective as you venture into restarting some of those conversations. So we all very much know that every person and every business has been impacted by the pandemic. For our business communities, it's been just as equally unstable and uncertain as it has been to each of us as individuals. And as we now start to move into the phases of reopening in many of our geographies, many businesses are only now beginning to return to some form of operations. And what we're finding is really that playbooks that show how we get back to work are only now starting to evolve, and they're very slowly emerging. So it's very much a learning process for most of the businesses that are trying to return to some form of providing services from an operational standpoint. I think first, and for any others who are engaged in business operations, it's really important for all of us to acknowledge that, you know, nobody stands alone in feeling a little topsy-turvy at this point. I work for a very large global organization, and I can tell you that one thing that we have discovered is that as big as we are and as much emphasis as we have always historically placed on workplace safety, we really didn't have a playbook in place when coronavirus struck. And so I think, you know, it's really important for everybody to recognize that that's okay. And really the worst thing any of us can do right now is pretend that we have all the answers, because we just simply don't. This is a new course, and we're all having to learn together. I think from Siemens' perspective, because the services that we are providing are an inherent part of maintaining the building environment, we fortunately weren't faced with any type of decision to potentially close our doors. But with that said, almost immediately, it was very evident that our customers wanted to know what our operational bandwidth really was, and that they wanted to be assured of the continuity of our services. And getting that information out the door very quickly was really a high priority to us and to those that we serve. All of the businesses that have maintained operations throughout the stay-at-home period have really had to immerse themselves into learning and adapting to a very new way of doing business almost immediately. we had to, if for no other purpose, simply to make certain that we were able to operate and support our own customers. We've witnessed similar types of focused initiatives in the food services, which we've seen have to pivot to provide for curbside service and delivery. I know for us, for Siemens, we had to be very flexible in regards to how services were delivered in order to support some of our high priority customers, like our healthcare consumers, our higher education, and our K-12 industries that are really all now scrambling to understand what the new norm is and how really they need to go about to get there. As I was kind of thinking about my comments for today, and I think back over the last several months, I think that on the one hand, the impact of the virus has been very hard felt. On the other hand, it's provided businesses with an opportunity to really gain some clarity around the role of our customers and our own organization post-COVID. So for us, for an example, we've walked away from the experience with a better focus on where we need to be investing. So as an example, it's become very increasingly clear to us that access to data and digitalization services really designed to minimize on-site manual operation are very likely to be an increasing important part of providing for a safe environment moving forward. And so we recognize that that's an area we really need to be investing in. Michelle has advanced, you can see a slide here in regards to some of our customers. So as a business lead, I can say that almost immediately my team found ourselves with a very new challenge. How do we stay engaged with, and more appropriately, how do we relate to our customers when they had so much going on their plate? We really struggled to understand how to be there and how to support those that we serve without feeling or appearing opportunistic. And yet, from a financial perspective, as a business, we too had to have business continuity in order to continue to be open and to serve. In our case, we found that the approach that we had to take was to be very intentional. And what I mean by that is that we adapted to really start every conversation asking our customers, how can we serve you better? And we really let our customers tell us where conversations needed to go moving forward. It's been a very person-to-person type of interaction, which I think is interesting given the fact that there's been such a lack of in-person connectivity. It's been very productive, and I wanted to share what our customers are telling us with the hope that it might give you some enlightenment as to some of the things that your own customers are feeling. And you can see some of the things on the slide. It's really meant to kind of capture some of those messages. But what they've told us is that they really need help with the immediate impact, but equally important, they need help developing a plan to avoid anything like this again in the future. They need to keep their own customers, and in our cases, students, patients, faculty, staff, they really need a plan that will keep them safe and healthy as they reopen, but even moving into the future. And they really need to understand what their options are and how. I think one of the most compelling messages we're getting is they need to know how they can do even more now than ever before with even fewer resources and without putting folks at harm's way. So we're finding businesses really having a challenge around a balance of where to invest and how to make decisions moving forward. Michelle, if you'll move to the next slide for me, that would be great. So here's how we've tried to respond, just as an example for you to use. First, we really haven't limited ourselves to simply thinking about how to do business different. We're also looking at what we do as a business with the greater post-COVID goals in mind. So as a result, we found ourselves evolving in reaction to customer feedback that we have received. In our conversations, our customers with our customers, we very quickly learned that the virus has impacted their ability to serve their customers. And believe it or not, all of the areas that's shown here on, and I recognize this is a bit of an eye chart, but it's really just meant to show that, you know, there is a huge diversity of areas within their own operations that the coronavirus has directly been felt in their own organizations. So this is really where we immediately became and are still very, very much focused. The most profound change for us from an operational perspective, and one that we have to be willing to make, is that we are intentionally moving our technology platforms to help customers leverage access to information. We recognize that this is really going to be an inherent part of operations moving forward. We know with some level of certainty that this type of infrastructure, I like to call it transparency, is going to be needed, especially in order to track and trace in the most immediate and future form, and really as a measure of having a plan that maintains social distancing and allows facility owners to evaluate and improve environmental performance in the indoor environment, and allows them really to anticipate rather than react. And most importantly, to serve their customers in times when needed at a real arm's distance. So I've really tried to provide kind of a basic overview here on how the pandemic has impacted our business operations and some of our customers and what we're hearing from them, hoping that you might pick up a nugget or two relative to your own enterprises. And again, we all do business with business, or we all rely on businesses. So I think it's really important to understand kind of what the challenges are happening on that end. I do, on a more personal note, want to share just a couple comments on how this has impacted business personally. From my team's perspective, I think the team has really learned to lean on each other in a way that they've never had to before. I find that my staff is getting new information daily in multiple forms, and most of it is really truly meaningful information to our customers. But deploying the amount of information that is coming our way alone is really a mammoth feat, and one that can't be done by any single individual. And so even if they're Superman, and so we're finding our teams really having to work together to manage the onslaught of information and get it out to the market. We've also had to get out of our own way and our old way of doing things. Just getting a group of business colleagues to make productive use of a video call only a few months ago was a challenge, and yet we're finding it now very much standard practice. I think so many of us 4 months ago wouldn't have imagined that we would be on as many video calls as we are, and now it's just become a routine course of doing business. But of course, this too is coming with some new challenges. It can feel obviously detached and impersonal and counterintuitive to creating a sense of team. And I'm finding the role of a business unit lead now really includes kind of mapping a path that maintains a sense of community across the organization, in spite of the fact that we really are not personally connected in the way that we were as we went into 2020. Personally, I think the pandemic has really challenged us to take time out from our normal routines. And also kind of take some time out from our traditional cadence of business. It's forced us as individuals and as an organization to approach business conversations very differently. And I think it's forced us to ask not only our customers, but ourselves and our colleagues, how are we doing and how can we really be helping? And I'm hopeful that outcome in particular might stick around for a while and become really an inherent part of what we're calling our new way of doing business. So, those are my thoughts from a business perspective and operations. I hope there's something that's meaningful to everybody that's dialed in today, and I'm happy to ask questions, answer questions as we round up, and Devetta has a chance to share her thoughts as well. So thank you, Nandini.
Yes, thank you so much, Alison. That was really wonderful, very educational comment related to how the companies, big companies like Siemens, are doing with respect to coping up with this new way of doing business. And as you mentioned, your team has stepped up to the plate and doing things. And we have all learned some, different skill set, competencies, multidisciplined approach to make ourselves more working efficiently and so on and so forth. So really right on, and truly appreciate your insights into this operational side of the business. Thank you so much, Alison. And now we'll go to the second talk, and we have Devra Thatcher from NYSERDA, New York State Energy Office. Devra is a senior project manager, and I'm sure many of you in the audience would have heard of Devra. She is responsible for the clean energy workforce development and training, where her focus is on building, operation, and maintenance. Prior to that, Devra helped develop some important initiatives in NYSERDA, solar and combined heat and power programs. I myself am witness to that because I've seen Devra do wonders on stages in NYSERDA, and I always wonder, how can I become her friend one day, So I am so happy that she came into our fold, our CWEEL family recently, and so we can't thank her enough for that. Devra holds a BS, a Master's in Mechanical Engineering, and an MBA from Rensselaer Polytechnic Institute. She also has served as the board member in the AWE New York chapter since last year. And more importantly, for her contributions to the career of women in New York State, Devra was awarded the 2019 Dr. Shirley Hansen Award by the CWEEL organization. We couldn't have picked a more qualified individual professional for this award. So we were very, very proud. We were very, very thrilled to have Devra join us in New York City, at Washington City last year. And we have a picture of that, Lori Beacon Jackson on the right, and myself, and we had this in Washington, D.C., as I mentioned last year. And so, Devra, the floor is yours.
Thank you. I'm blushing over here with all of that praise. Thank you. I love working with you and with the women in CWEEL, and certainly it's almost an all-male troop with my group down in New York City on the board of the New York City chapter of AEE, but I'm doing my best to bring more women into the fold of AEE in New York. So my story is a little bit different. I could talk to you about how COVID has impacted my work. I manage the building operations and maintenance contracts that we have with large facilities in New York to train their building O&M folks. And obviously very little of that is happening right now. So I manage a whole bunch of stalled projects. But I'm going to share on a personal note. And I think this is important from the standpoint of, I talk to many people who say, oh, I don't know anybody who has had the COVID. Well, now that you've been on this webinar, you do. You do. And the story of my experience with the virus starts with my mother-in-law. And I think the next slide is the one I'd like you to put up. Michelle? Okay. This dates back to April 30th. Well, my mother-in-law, when Governor Cuomo first announced the pause, which was in mid-March, she fell in her home, ended up in Albany Medical Center. My husband went down to the ER. We had already been taking this COVID very seriously. We had gone grocery shopping in early February. We had enough cat and dog food to make a couple weeks through. And when she fell, we got really, really serious about just the two of us being in our little COVID bubble, because she was moved from the hospital into a rehab center to help with rehabbing the broken shoulder. That was the rehab center she was in, Our Lady of Mercy Life Center. A couple weeks into her stay there, we found out that the physical therapist who had worked with many of the residents, including my mother-in-law, had tested positive for COVID. Mom's test came back negative. And our thought was, we need to get her out of there. About a week went by before she was physically well enough for us to take her home. And my husband actually took her to her own home, and he was staying there with her. He spent 8 nights with her at her own home. Well, this April 30th date, and this came from one of the many updates, in fact, 51st update from my little town of Guilderland in Albany County, New York. 44 residents as of that date had tested positive, and 13 staff members. We did not realize that Mom had brought the COVID home with her. She was having symptoms that made us think that, well, it was because she was still on the heavy painkillers for the pain in the shoulder. And we just couldn't get her to be alert, and we were baffled. And I said to my husband, I don't think she's getting enough oxygen. Like, her thought processing was off. She couldn't find her own bathroom in her own house. So we ordered a pulse oximeter to check your oxygen saturation. After 7 days of caring for her and then coming home to me for dinner time and then going back over to Mom's, my husband called in his brother for support. He came in from Springfield, Mass. To Albany. The next day, my husband ended up with a 101.5 fever. And the pulse oximeter came in, and we checked Mom's blood oxygen, which was in the first test at 70%, which is kind of like you're dead. And then we were told, warm her hand up more, check it again, and she was about 85. Now, normal blood oxygen saturation is between 95 and 100. And you can go down to 90 and still be okay. But if you're at 85, you should be hospitalized. Because it means that your organs, your brain, nothing is getting the amount of oxygen that's required. Mom ended up back in the hospital. The first thing they did was tested her for the COVID, and sure enough, that was the culprit. She spent at least a couple more weeks there, and my husband got tested. He was positive. He had 101.5 fever for about 10 days in our living room on the couch. And when he tested positive, I never had a thought of, oh my God, where am I going to go? No, I stayed. I stayed with him to care for him. It seemed silly to try to retreat after having visited Mom, had Easter with her. You know, it was kind of silly to retreat. So I ended up caring for my husband. My brother-in-law came down with a 103.5 fever. He was tested. He was positive. He ended up in the hospital. My mother-in-law's life was truly saved by a plasma transfusion or plasma treatment, but not before we had conversations with the doctors at the hospital about intubations. And they talked to us about how with an intubation, 0 to 10% of people who are put on a respirator ever recover. Because of the plasma treatment, thank God she never had to be put on the respirator. She spent more time in the hospital, then went to this same rehab. She's back at Our Lady of Mercy for another couple weeks. She's now home, and my sister-in-law's caring for her. My brother-in-law ended up in the hospital also for about 4 days with a fever that high, and his blood oxygen went below 90. My husband toughed it out in our living room for about 2 weeks with the high fever. I got tested for the COVID and tested negative. And my doctor said, you know, the amount of exposure that I had, that I can presume that it was positive. I never got as ill as any of them. My husband was thinking about writing letters to our children because he thought he was going to die. I'm watching him, and he's so stubborn, and his blood oxygen, he's playing games of, well, like, if it gets to 88, then I'll go to the hospital. Well, then it get to 88. Okay, if it gets to 85, I'll go. And it gets to 85. Well, but it wasn't sustained at 85. So I'm just watching him thinking, at some point, he is going to pass out, and then I can call 911 and get him to the hospital, and I hope we get there in time. My symptoms were much less. I never had a fever of above 99.9. I had really bad fatigue. I was sleeping 14 hours a day. I had the cough going, which is still going. Our daughter, who had been one of those silly ones who went to Florida on spring break, she had the COVID out in Colorado. Her only symptom was the loss of taste and smell. And it's now probably 8 weeks, and she still does not have her taste and smell back. It's a really, my husband said I wouldn't wish this on my worst enemy. If you have a chance to wear a mask, wear a mask. Like the way of protecting ourselves now seems much more simple. And now, as many states in the nation are opening up, I just want to try to impress upon people the importance of wearing the masks. And more so because if you have it, you're not going to spread it wearing a mask. There's still a higher percentage of catching it wearing a mask. But we're all smart women who have been reading the press and know what we need to do. There was one thing that, well, first I want to say I have great gratitude to the state of New York, because one of Governor Cuomo's policies was that if any state employees who were working at home contracted the disease, the virus, that we would get 2 weeks of paid sick time without having to charge it. And I'm really grateful that I had that. That was a wonderful benefit to the state of New York. When I was home, my husband shared, and please move to the next slide, he shared this, which was a tweet that went really viral back in March. And it's the Canadian federal government tips for working remotely. And I read that first one, and I started to sob. Because first, working at home, we all had this sense of, oh, yay, now I get to work remotely, which means I don't have my commute, or I have the perks of being able to work from my lake house or whatever else. But I think the hardest thing about this whole virus for all of us is number one, we are not working from home. This is not a great bonus of, yay, we all get to be remote. We're at home during a crisis trying to work. Many of us are mothers and are caring for children at home, or we're caring for aging parents, as the case was with my husband and myself. One of my coworkers, she had the same exact scenario as I did, and her father has ended up dying from the COVID and related problems. But I just wanted to share these principles with y'all because this isn't normal. And when I was trying to pretend that this is normal, and I was trying to hold myself to my usual outbox coefficient, and how much work did I get done today? I kept failing myself, both before I had the illness and after I've had the illness. And this is my message, just giving you what I read from the Canadian government, that being kind to ourselves, being kind to others, don't judge ourselves or others by each other's yardstick, don't expect what we normally would out of ourselves, and remember that we're not working from home, we're at home during a crisis trying to work. So thank you all for listening.
Thank you very much, Devata. We certainly feel for you. We certainly feel for what you had to endure at the home front. You had to muster your strength and courage and take care of your mother-in-law, brother-in-law, husband, like stubborn one, as you said, and
everyone,
we all have that. We all have, yes, in our home, and yourself, making sure that you are not impacted also, and so on. My God, that takes a whole lot of effort and strength and so on. So thank you so much for sharing that perspective of the COVID and the impact. Now we move on to the Q&A session, and please do send in your questions if you haven't done already to the chat box, and we will start responding. I hope we have addressed them to the specific speakers also, Devitt and Alison. And, Michelle, would you like to read the questions while I'm waiting for mine to queue up?
Yeah, so we have, looks like a question for Allison. It says, from Lori Wiegand-Jackson, are you finding commercial office spaces taking action already to address the healthy indoor environment issues, or are people going to continue to work from home instead of in an office?
Yeah, I think we're seeing a blend of it. We're seeing some commercial office buildings starting to open in a very limited capacity, and specifically around commercial office buildings because it can be managed. They're really putting kind of scheduling occupancy in place where they're allowing certain people to work certain days, and those are the only people that are allowed in the building. They're really maintaining, something in the magnitude of maybe a 10% to 15% occupancy just based on scheduling, where less commercial office spaces and public spaces, we really aren't seeing them bringing folks in yet. And then for those commercial office spaces, we're really starting to see them use the time during this reduced capacity to start to explore from a technology standpoint ways that they can provide for increased oxygenation, ionization of the air, et cetera, to really move the dial on the cleanliness of the environment, how they're using UV light to really manage PPE equipment and sterilization. I mean, all of those types of things are just now we're starting to see really start to be explored, especially in the commercial real estate area.
Okay, great. We have another question for Allison from Janine. She says, Allison, your last slide had a list of items which included deferring capital budgets. Can you give some examples of what capital investments are being deferred as a result of COVID?
Yeah, so I think generally new construction, we're definitely seeing impacts on new construction really moving forward at this point. But I think even, I use the term capital items kind of loosely to also include, existing infrastructure that has, I think across the country, regardless of what market you're talking about, there is an increased amount of aged infrastructure where there's capital investments needed for end-of-life infrastructure issues that has just been deferred. We call it deferred maintenance year after year after year. And we're continuing, where we started to see kind of coming into the year more paths to addressing those. It's now put those on the back burner in priority from, doing the types of things from thermal scanning and tracking and tracing that has now moved up in the priority list, and those deferred maintenance items have yet again kind of fallen to the wayside. I think the impact is you're going to see more and more of the market looking at alternative paths to kind of supporting these projects, P3 structures, third-party ownership, et cetera, but nobody's there right now. Nobody's really thinking in those regards. Right now, they're just really responding to what the most urgent needs are in the facilities.
I have a comment.
Looks like we have,
Yeah.
Go ahead, Nandini.
I was just going to read out a comment to Devata. Devata, what a moving story. Thanks for sharing, especially the 6 tips. Quite educational. This is from Julia. Yes. Go ahead, Michelle.
Okay, we have, well, another comment from Soph. What a moving story. Thanks for the share and the reminders of the challenges in which we are living.
Mm-hmm.
And then it looks like another question for Alison from Marianne. Any tips on how to handle all the information flow? And is there a process of sharing that info with your team? And Devata, you might be able to comment on that too with your team at NYSERDA.
Yeah, I wish I had like the magic answer to that, because it's definitely something that myself personally and the entirety of my team is really struggling with. I think just kind of my approach thus far is really to be a filter for them and get in front of it, and then kind of move through what is relevant and what isn't relevant, and then kind of put together a format where I can forward what's relevant and needs to be addressed, right now, and separate it from kind of a little bit of the other noise. I mean, but look, I'm open to ideas from others on how to do it, because we've definitely found it to be one of the most significant challenges. And our concern is we don't want anything to fall through the gaps that's beneficial, that we should be making sure that gets out into the community and market. Devata, I'm curious about your perspective.
My perspective is we've got the leadership at the state of New York making all of the decisions on reopening for state employees. So I just basically, my group and I sit back and wait to hear. At this point, New York, the Albany area is in phase 2 of our reopening, and the employees at NYSERDA have all been invited to volunteer to go back. And there's a small subset of people who said, yes, I'll go back. It doesn't have to be full time. 1-2 days a week is what one of my colleagues is doing. And I don't really know where we're going from here. But I can tell you our New York City office, I have a regular call with the women in New York, and people are not eager to get back on the trains and head into the city. So it may be a very long time before the offices in New York City are up and running.
Yes. Actually, this ties in with the next question also, Devata, for you, which says, Devata, do you think there are any long-lasting impacts, or is it too early to tell? And what suggestion do you have for all of us as states move to reopen in varying stages, in addition to wearing masks and social distancing?
That's a really, the first question is easier to answer than the second. Yes, there are long-term impacts. I lost nouns. This definitely affects our capacity. I was pointing at a street light and I called it a fire hydrant. And it's beyond the normal, I'm headed towards 60 kind of thing. There's long-term, yes, I think we're gonna find more and more long-term effects. I'll tell you, it has taken the family, my brother-in-law, my mother-in-law, and John, many weeks to try to get back to normal. And he's probably 95% now, and it's been a month since he had it. It was a little better for me. The emotional impacts go on. In terms of the second part of the question, which, see, I've forgotten already. Second part of the question was harder to answer. Nandini, tell me again. Second part of the question is?
So do you think some of us have to be more ready as states start to open in various stages? Yes. Besides wearing masks and social distancing, should we do something different?
I'm going to be an advocate for safely opening up our COVID bubbles. What my experience was that for my husband and me to be isolated, just the two of us, because in the back of our minds, it's like, we're going to end up bringing mom home and we need to make sure we're still healthy. I had severe emotional impact to not seeing friends, not being with people. Zoom is not good enough. And for me, I'm now being smarter about opening my bubble to other people, to do walks together with our masks on, to now that we can sit outside at a restaurant, to sit outside at a cafe somewhere and visit with a friend. The masks are important, but we need to remember also that the masks were never meant to keep everyone safe from getting this. They were meant to be sure that there'd be a hospital bed for you if you get it. So it depends what state you're in, because some states, those numbers are going up and up right now. In New York, our numbers are going down. If you're in one of the states where the numbers are going up, please take it seriously, keep masked, keep social distancing. If you do gather with friends, have it be outside. That's my best, but don't crawl into a hole all by yourself, because then the impact on our emotional and our mental components is probably as bad as the physical.
Michelle, would you like to read the next one? There is one from Mary Ann also. Mary Ann McGovern has this question. Alison, any tips on how to handle all the information flow? And is there a process of sharing that information with your team?
I think that's the one we just answered, Nandini, which was, we don't have an answer.
Oh, okay, I'm sorry. Okay, it's coming in slowly for me. I'm sorry. Okay.
Yeah, that's okay.
Is there anything else popping up on your end, Michelle?
I just see one more from Julia that says, what does the roadmap look like for Siemens for people slowly coming back to work at the office?
Well, I think for us, so we've had essential folks that, I mean, we're a company that has trucks on the road. We're a business that we had to maintain a certain amount of operational, just to support buildings that had to, whether they were occupied or not, they had to be able to function and stay to some degree open. I think as far as coming back in our offices, I think it's very much geographical. So, some areas in the country are a step ahead of other areas in the country, but we're not finding that any of our offices, even those that are a little bit further along and better poised, are really putting any pressure on anybody that come back to the office. I think one of the things that we really have learned is that, we can do business without all of us sitting in an office building together in a conference room. And it doesn't remove that there are situations where that's the best served way to have business continuity, but it's not the only way. And I think it's something that we've learned. And I really if I had a crystal ball, my guess is that we probably won't see any of our offices anytime in the near future at the type of capacity that we used to operate before the pandemic. I just don't see that us ever going back. I just think it's going to be very different moving forward.
All right, I think we are coming to the end of the hour, and our sincere thanks to you both, Alison and Devra. You covered different ends of the spectrum for this COVID impact, and truly appreciate your perspectives. They were really, really well presented and excellent comments and so on. So thank you so much for being with us. And thanks to you, Michelle, for taking care of all the technical work from the background. And you're someone who we can count on always from the CWEEL organization. So kudos to you. And then, of course, to you all, audience, and my colleagues from CWEEL, AWE, and so on. Thank you so much for tuning in and spending a good part of your afternoon with us. And I hope that you will continue to stay safe, happy, healthy, and work as safe as possible. And I strongly believe that this too shall pass. So With that, many thanks again. Have a wonderful afternoon.
Great. Thank you.